Hello and welcome. Today we're going to talk about something that can cause some really confusing and frustrating symptoms, cervical rib syndrome. So if you've been dealing with some weird neck, shoulder, or arm pain that you just can't figure out, hopefully this will bring some clarity. All right, let's get into it.
So, does this sound like you? You've got this nagging pain in your neck, maybe your shoulder, and it feels like it's shooting down your arm. Or maybe you've noticed this odd numbness, like a pins and needles feeling, especially in your pinky and ring fingers. Well, you're not imagining things. Those feelings are actually really important clues.
Now what's really interesting here is that these symptoms fall into two different camps. On one side, you have the nerve-related stuff. That's the pain, the tingling, maybe your grip feels a little weaker. That's your nerves telling you they're being squeezed. Then, on the other side, you have issues with your blood vessels, like your hand feeling cold, looking pale, or even a weak pulse at your wrist. When you see both types of symptoms together, it's a huge sign that what you're feeling isn't random. It's a classic pattern.
Okay, so what in the world is causing all this? Well, the answer is often something that's literally been hiding in your body your entire life, and you probably never even knew it was there. Let's peel back the layers and take a look at a pretty fascinating little quirk of human anatomy. Meet the cervical rib. It is, quite simply, an extra rib. Most of us have 12 pairs, but some people have a little bonus one that grows out from the C7 vertebra, which is right at the base of your neck. It might sound kind of strange, but it's not as uncommon as you might think.
And here's the most important thing to know right off the bat. You're born with this. You didn't do anything to cause it. And for almost everyone who has one, it causes zero problems. It just hangs out, completely unnoticed. A lot of people only find out they have one by accident when they get an X-ray for something totally unrelated.
In fact, check out this number. Only about 10% of people who actually have a cervical rib ever develop any symptoms from it. That means, for the other 90% of folks, it's just a quiet anatomical feature that never causes any trouble. And that's a really key fact, because it shows that this is a manageable issue, not some terrible defect. Which leads us to the big question, right? If this little extra rib is totally harmless for most people, what changes? How does it go from being a silent passenger to suddenly causing all this pain and numbness? The whole problem boils down to one word: compression. Just imagine that the space at the base of your neck is like a super busy highway, with all the nerves and blood vessels traveling from your spine down to your arm. A cervical rib is like an unexpected bit of construction that suddenly narrows a lane. That cramped space can start to squeeze those nerves and blood vessels, and that's what triggers all the symptoms we were just talking about.
So, how do doctors figure all this out? Well, the process is actually pretty straightforward. It usually starts with the physical exam, then they'll do some specific tests designed to see if they can recreate your symptoms on the spot. And finally, they'll often confirm it all with an image, usually just a simple X-ray, which can show that extra rib clear as day.
Now, one of the most common and important of those hands-on clinical tests is something called the Adson test. It's a really simple, non-invasive maneuver that your doctor can do right there in the office, and it gives a very strong clue that the cervical rib is indeed the source of the compression. And here's exactly how it works. It's just a simple sequence of movements. First, you'll turn your head to look toward the side that's bothering you. Then, you'll take a really deep breath and just hold it for a few seconds. And the whole time you're doing this, your doctor will have their fingers on your wrist, checking your pulse. So what are they looking for? Well, if your pulse gets weaker or even disappears completely during that maneuver, that's what's called a positive test. It means that specific positions squeeze that highway in your neck even more, pinching the artery against the cervical rib and cutting down the blood flow to your arm. It's a way to directly connect the dots between that extra rib and the symptoms you're feeling.
Okay, so let's say you get the diagnosis. What's next?
Well, the really good news is that for almost everyone, the path to feeling better starts with conservative, non-surgical treatment. We're not jumping straight to surgery here. The entire idea behind this first-line treatment is summed up perfectly right here. The goal is to create more space. That's it. The problem is that things are too crowded in there, so the solution is to open things up. Physical therapy isn't just a bunch of random exercises. It's a targeted strategy to decompress that area and give your nerves and blood vessels some breathing room. So this is what that first line of defense looks like. A physical therapist will work with you on your posture and give you exercises to strengthen the muscles around your shoulders, which helps hold everything in a better position. You'll also learn which activities to avoid, like a lot of repetitive overhead work. And sometimes this is combined with pain relievers or even a targeted injection to help calm down the inflammation.
But you know, the question always comes up, what if that's not enough? What happens if you do all the physical therapy and you're still in pain?
It's really important to know that considering surgery isn't a failure. It's just the next logical step for a very specific set of situations. So, what are they?
This chart lays it out really clearly. On the left, you see conservative care as the answer for most people, especially when symptoms are mild to moderate. Now on the right, surgery starts to become an option when things are more serious, like if there's severe muscle weakness, major problems with blood flow, or simply when months of conservative therapy just haven't brought any relief.
And the goal of the surgery is just as simple and direct as the goal of physical therapy: relieve the pressure. The surgeon goes in and removes the extra rib, or sometimes just cuts through tight bands of tissue around it. Either way, the goal is to permanently open up that highway and give your nerves and blood vessels the space they need.
At the end of the day, the most powerful tool you have in all of this is simply understanding what's going on. Knowing what a cervical rib is, why it can cause these symptoms, and what the clear, logical steps are for treatment. That knowledge puts you back in the driver's seat. It turns a confusing and scary set of symptoms into a condition that you can actively manage and overcome.